Finally, the last two studies I'm going to look at are more focused in chronic disease, done with Dr. Tim Church and Stephen Blair. First one was done, again, at the Cooper Institute. This is Dr. Church's study in FLAME, looking at C-reactive protein. The results were just recently published. They did a 6-week run-in period. Again, they were able to test the participants' desire to be in the study, because once you randomize them, you have to analyze them. So they really tested them, see if they wanted to be in the study, and then they engaged them in 16 weeks of the intervention. And this maximal test again was on a cycle ergometer, and then the heart rate intensity was 60–80% of the VO2 max. They, again, 16 KKWs, so we're seeing this similar 16 or 17.5 dose per week over 3 to 5 sessions. Now you're seeing a forced modality between cycle and treadmill. They thought their thought going into it was that the treadmill would create more injury situations. They said, well, we'll exercise on treadmill because usually it's more acceptable to the participants, but then we'll cycle them off onto a cycle ergometer the next session, and hopefully that'll prevent injury. They did allow a makeup or a carryover of dose, so if I happen to miss one of my laboratory sessions, we would give you a heart rate monitor, and you could do it on your own the weekend and bring the data back to us. So these things I'm going to relate them all to how our study as we go along here. Final study just came out in JAMA. Dr. Church is now at Pennington down in Baton Rouge. Looking at type 2 diabetics, they had a whole bunch of different groups here, but we're just going to focus on the aerobic condition for now. It's a 9-month intervention. They had these individuals come into the lab, all supervised sessions, nothing at home, all supervised for 9 months. Now they've switched. They've gone max testing on the treadmill, and all the sessions are done on the treadmill. So they're matching the max test with the intervention. And they're doing 12 KKWs. 12 KKWs is approximately 150 minutes per week, which now meets or matches our current guidelines, for physical activity recommendations. They're doing 50 to 80% of maximal oxygen consumption, so this is now in the range of moderate to vigorous, depending on how hard a participant works.